system of medicine, like where we go to doctors and get treated. But when we adapt this type of care management system, what is the acceptability or affordability of the people where we have more of the rural population with socio-economic status? So what is the predictable outcome, at least in the future 10 years? Thank you, sir.
Good morning, everyone. Thank you, InFocus, Mr. Vishy and his team, for giving me an opportunity to share our thoughts how medical care is going to progress over the next few years. Let us look at how you were communicating with one another exactly a decade ago. Did you have WhatsApp? Did you have Facebook? Did you have Twitter? No. If you want to have food in the evening or late in the night, now you have got Zomatos and Swiggies. If you want to travel to Ramantapur, you don't need to have your own car now. You have the Uber and Ola vying with one another to give you a free ride. This is the power of the digital era. The team at InFocus RX has rightly brought how this digital dividend can be harnessed by the healthcare sector. So what's happening is the rest of the sectors, like the movie industry, you want to go to a movie, you don't need to buy the ticket in the black market, nor you need to stand in the queue for 2 hours to get a ticket of your favorite hero or heroine. So those days are gone now. But still, when you come to the healthcare, is it any different? I am afraid to say it is not as different, because still you need to wait for a doctor for a couple of hours. You need to wait for a doctor for his appointment for 3 to 4 weeks. You need to wait for the laboratory test to arrive after about a day or two, or sometimes after about a week. Should the process be more smoother, the experience of the consumer to be more better? We are all consumers, if you look at in the real terms in the healthcare. We are moving from a era of a doctor-patient to an era where a patient is becoming a client, not a patient anymore. So it's more of a, there is a human element, we cannot disregard that, but what we need to do is, as people closely involved in the healthcare, we need to make it more accessible. Doctors need to be more affable, and they should be, their medical services should be available where the people need them. So with this, what I would like to share you this afternoon is a concept which is getting more and more popular in the Western world, that is the care management program. From an era where the people have to come to the doctor, the health services are going to the patient. If you look at it, I was telling you, you need to wait for 2 hours to see a doctor. How can the doctor go to a place and see your patient? It is impossible. That is where we need to build teams. So the teams cannot be managed by doctors. So that is where all of you young people who are sitting here can have a lot of opportunities. The only thing is, you need to think. You need to think how you can harness, how you will be able to deliver the healthcare much easily to the patient. So that is what is the care management program. You will move the slide? Yeah, thank you. So let's go to the first slide, please. So what we have, what I wanted to tell is, availability of the healthcare where it is needed cannot be possible with the physician alone. So the care management program tries to deliver not only the medication but also the patient support system. Next please. So most of the care management programs, they have been focusing on chronic disease management. Chronic means a disease which is persisting for a long period of time, mostly over a lifetime. So common examples, what you see, some of our family members get affected like high blood pressure, diabetes, heart problems. So those are the diseases. Unfortunately, if a patient or a person gets affected, it will be there with them all through the life. So care management programs are a new concept where instead of the doctor taking care of the ailment, a team of specialists. The team is not a healthcare specialist, but the patient's team. The patient has got a team who is a doctor, who is a dietitian, who is a physiotherapist, who is a clinical pharmacist, who is a skilled nurse. All of them form the patient's team. What we are talking till now is a medical team treating the doctor, but what we need to think of is a patient having his own team to fight a disease. That is what is exactly the care management programs. For example, if a person has got diabetes and a person, you all know that a person has got a diabetes which is controlled versus which is not controlled, obviously the non-controlled person is going to have higher problems. But if you have a support system for the patient where we help the patient to control his diabetes with periodic reminders, periodic blood investigations, definitely that is what is the care management program. Next please. So these care management program has got multiple components. For any of these programs to succeed, we need to have a person who can plan, who can solve the problem, who can make a decision making, who needs to collaborate with other disciplines, and then who has to have the ability to budget for the program as well as to raise the funding. So all these things come from the role of a care manager. For example, we formulate a care management program for diabetes control. A manager should be able to design the program, recruit the people, harness their skills and run the program. So who is the person who is the manager? Doctor? Not possible. So some of you who have done the business administration or a healthcare management program, those are the group of people, or a senior physician like Dr. Gatala who have moved from a primary physician job to a administrative job. Those are the people who are going to have this role of a care manager. Next please. In this program, what happens is, whenever we treat a person, let's say I give an example of diabetes, the onus of treating the diabetes, for example, he has a blood sugar of 300. The blood sugar is not controlled. When they come to the doctor for a appointment, they say, sir, your medicines did not work. So what is the problem? Because the person did not understand how to monitor his blood glucose. So that is where we need to give education to the patient, where we can, once we educate and partner with the patient, we will be able to improve the quality. And also, once we improve the quality, that is the control of diabetes is better, obviously the cost is also reduced for the patient to develop some other problem like heart problem or heart failure or something. So what is happening, if you see even in India also, you must have seen our Prime Minister's effort of what is the next phase in which he has focused on health hubs where chronic disease management is being controlled. So who are the people who are going to manage? People like you who are life science graduates have to be employed in these systems. So the government, the policy mandate also is there right now from the current government that they are going to manage the chronic disease program by dedicated clinics. So we need to understand from a hospital management where a person goes with a high blood glucose, the transition is happening to a scenario where the treatment is not for the episode, but where it is a continuous process. For monitoring a continuous process, we need lot of staff. Next please. Next please, we go forward. So what are the important things is, it is not just treatment on a chronic disease program where you can prevent disease. Like for example, a person did not develop diabetes, but he has got the propensity to develop. How he can prevent it? So the insurance companies all over the world are monitoring whether this person has got good healthy habits, then your premium is low. If the health habits are not good, then your premium will be high. So it is not just from a health point, but also from a financial aspect, the preventive care is coming up very rapidly. Then the critical care. For example, a person was very sick, admitted in the hospital for 2 weeks, then he has to go back to his home or go back to another center. How he is going to manage himself is where there is a transition care. That means from a hospital to a home. Once he goes to home, how he should behave, how he should lead his life. There is no education right now available for the patient, but that is going to happen soon. Next please. Next, let's go forward, please. Let's go forward. So now, apart from these things, we need to understand that we need to identify, when you are treating 10 patients, it is very easy for you to say this patient is high risk, this patient is low risk. But when you are treating a population of 1,000 people, then 900 people will not have high risk. Only 100 will be having risk, and out of them, only about 20 will be in high risk. So we need to identify from that 1,000, 20 people who are having that high risk. So we need to have some scores. That scores have to be developed not by seeing a patient, but by culling the data. So that is what we go forward. Next please. Next please. Let's go forward. So what are our opportunities for employment in this care health program, care management program or disease management program are? We all see the physicians are very less in our country. Doctors are very less. So we need to take the assistance of the nurses. If you take an average nurse, the usual work period of that lady or man is usually anywhere between 10 to 15 years, beyond which they will not have a productive employment. So that is where they can transition themselves into a care management program. People who have the care assistance, for example, any of you life science graduates will be of great help and great support for the family, and it gives you immense satisfaction. Let me tell you, young people here, when you work with a computer, there is no emotional satisfaction. But when you work with a patient, there is a great emotional satisfaction, a sense of fulfillment at the end of the day, which when you work in a care management program, it is possible for you to achieve. Next please. So if you look at the demand, what we require is, for example, an average group will have about 600 people. Even in the government of Telangana also, for the employees health scheme, that is for the government employees, when they put the chronic disease management clinics, that is what they call the health kiosk type of a scenario, they are reimbursing per patient a particular fund, irrespective of whether the person gets disease or no disease. So people who are running the center will get reimbursed. So the person who is running the center, it is his responsibility to take care of the patient as well as his family so that they don't get ill, or if they get ill, they need to be caught in the early phases of the illness. That is what is called in the United States of America as the Accountable Care Organization. That is what is an important component of Obamacare. In India also, definitely it is going to happen because people are demanding that whatever care they get, it has to be top of the class without any repeat episode. That is where we need to take care of the patient, not just by the doctor, but by a care assistant, by a nurse, telecaller, physiotherapist, data manager, pharmacist, so on and so forth. So let's go further. Next, please. So we go further into this. So all of you can become a part of this healthcare management or a care management program. All of you will have the opportunity, but for you to become that, possibly you need a good amount of training. A pre-job work training will help you to become a good worker in this team. Next, please. So I have given from my point of view few examples like diabetes, hypertension, high cholesterol, heart failure, osteoporosis, obesity, dyslipidemia. So all those things, high cholesterol, all those diseases, you need to have a continuous lifelong treatment where these management programs can be of help. Next, please. So now I will tell you the common scenarios what we see in our day-to-day practice. For example, an 80-year-old lady comes to us with heart failure. My job as a doctor is to prescribe her medicine. She goes back home, in about a week comes back again with the same problem. We do not understand what is the problem, why she has come back, because doctors do not have so much of time to go and interrogate in detail why this recurrence has happened. So what happens then, we go in detail, we understood that the person does not know whether to take the medicine or not to take the medicine. She forgets whether she has taken medicine or not. So that is because she has got coexistent dementia. Let's go to the next clinical scenario where you had a heart failure patient who had been given all the medicines. Nowadays what's happening is, children are there, they have a lot of money, but they do not have time. So what happens is, the child buys the medicine and gives them, but the father does not know how to take the medicine, so he never opens the medicine and takes them. So there should be a person who trains them how to use a proper drug and when to use it. Let's go to another scenario which is very common in our practice, that the physician to be in touch with the ability of the patient to afford the therapy. For example, a common disease like diabetes or hypertension, whenever we prescribe a medicine, the person comes back with very high sugar. Then what is the reason? Then when we ask them, sir, I cannot afford for medicine. So who is going to assess whether this person can afford a medicine which is worth 5 rupees or 1 rupee? So which brand they can afford, whether they are able to take the medicine? That is where the care management programs are going to make a lot of difference. Next, please. So people are going to enroll themselves in these care management programs. Hospitals have to start these care management programs because the medical care in India is also moving from an out-of-pocket to a third-party reimbursement model. That means somebody else is paying for your health, either the government or the insurance company or your employer. So we need to see that if your target population is good, then your costs are less. So the cost should be low, the patient experience should be better, and the health of the population should be better. That is the goal with which these healthcare programs go. Next, please. So what is important is, apart for us to get this therapy or in a good way, we need to have the data. That is where the IT professionals will have a large amount of role. Next, go please. Next. For example, please stay here, previous one. For example, whenever we are treating the patient, the encounter is in the hospital. But now what is happening is not a telemedicine, where once again it's an in-hospital experience, but a telehealth, where a person who is reasonably in a good condition gets his therapy and physical evaluation and diagnosis all through the internet, through a digital encounter. That is what is called the telehealth. So telehealth cannot be driven by physicians. It has to be driven by life science graduates. Either it could be a science graduate or a nursing graduate or a physical therapy graduate. So what's happening is, this telehealth will help you to control your diseases, so the patient will not get admitted into the hospital. So people will opt more and more for that because they need not travel to the hospital. Next, please. Till now, what is happening is whenever we have a person who is coming into the hospital, we are focusing on a person. Like in the medicine, when we go to the ward, what is this patient? Nobody calls him by name, Mr. Ramarao or Mr. Venkatrao. Sir, he is a gastroenterology case, sir. He is a neurology case, sir. He is a cardiology case, sir. What is his name? Because we don't know. Sir, this is gastroenterology. What? So all patients of gastric problems are there in the ward. So the focus of the medical care is on the therapy. But what we have to do is, it is not, people are not coming only with gastric problem or cardiac problem, but they come with multiple problems. So we need to understand their medical problems, we need to understand their emotional requirements and their social needs. All these things are not possible by physicians. That is where we have lot of people like you who need to be available. And then the therapy in medicine right now is physician centered. That means we have gone to so and so doctor. But what is happening is, so and so has been treated by so and so doctor. That is not there. I went to a particular doctor. So the treatment has to move from a physician to a patient oriented approach. And we need to use new therapies, like people going to the patient's doorstep. That is what we call as the primary care practitioners. These primary care practitioners need not be doctors. They can be allied medical professionals or a well-trained life science graduates. Next, please. The problems of healthcare in India are, it is a physician-centered approach. So doctors feel that they are the best, and that is how they want the patient to get treated. And it is driven by disease. It is driven by procedure. Most of the hospitals in India are urban-centric, and they are high-tech hospitals which are getting respected. The revenue which a doctor comes is by treating a disease, by operating him, or by performing a procedure. But what the people have is diabetes, heart failure, hypertension, which are difficult to be treated by surgeries. They have to be given lifelong medication and behavioral changes. Then I have not seen any doctor who has stopped with MBBS in the last 20 years and started as a family physician. So India does not have primary care doctors. Do you know any one of your friends who has completed MBBS and he wants to start practice? 100% you can say that there are no MBBS graduates who wants to start practice. But people need them. The population needs such doctors, but doctors are not going to stop. They want to do specialization. That is where. And another problem which is affecting in our country is, we do not have a large number of people who are going into the nursing profession because they are not respected well, they are not remunerated well. So nursing is not a choicest profession. They prefer to go into the information technology center. Next, please. So what do the Indian public want is a quality time from the caregivers, a cost-effective therapy, less of surgeries, less of interventions, appropriate but not exhaustive medicines, and a tailored therapy. Next, please. So I will show you certain examples what the government did. Government has already realized that there is a dearth of medical professionals in the rural community, in the mid-town cities or in the villages. So what did the government do? It wanted to introduce a bridge course. It was a good idea, but what happened? The Indian Medical Association and all the doctor organizations, medical organizations, fought against it, and the government had to retract the step. I think it is a great disservice to the community, but I am sure it is going to happen in some other form. The bridge is a more radical step, but to give a care development program, that's what now the Prime Minister has done, is from moving from a bridge course to a care management program which is happening in the government service. Next, please. So what is happening is, lot of people can be employed in these groups, like the Pharm D graduates. They are called the clinical pharmacists. You have got the senior nurses who are beyond ability to take care of the people on the floor of the ward. And MBA graduates, they can become care managers and they can market the services. Physiotherapists, social workers, all of them will have a lot of opportunity in this course. Next, please. So if you look at a typical scheme, the doctor will say, okay, my patient will get these therapies if it is hypertensive. For diabetic, these therapies. Like that, we can write a protocol. The rest of the team, like the care manager, the other people who are like the dietitians, nurse practitioner, clinical pharmacist, social worker will engage with the patient and deliver the health care. So the therapy is already determined, that engagement will happen by people like you and you will get immense satisfaction. Please do not look at inanimate computers as the source of this one. A typical, next please, as a typical IT person, a typical IT person will have a shelf life, that's what we call for the medicine, a shelf life of around 10 to 15 years. Beyond 15 years, the employability of the IT professional comes down drastically. But if a person opts for a health care, they will have a life from 25 till 65. They will have a 40-year lifespan. So do not look at an immediate gratification or an immediate better pay scale. As you get trained better, you will get more and more opportunities. Don't look at what you earn at 25, but look at what you earn at 40. What you need money is at 40, but not at 25. This is my personal experience. So we need to be very clear what you want, when you want, how much you want. So that degree of remunerative opportunities will be there, more in the healthcare. Digital healthcare gives you an opportunity to transform from a life sciences person to a allied medical professional. Please do not lose the bus. You will have. So I will show you a few case examples of what is being done in the West in this year's journals. The first is, what they did is, in America, people go to the same barber shop. So every 2 weeks a person in the barber shop. So in the barber shop, they tried to measure their blood pressure, and in the barber shop, they started giving them medicines. One approach is being given the medication by the doctor, one approach is being given by the clinical pharmacist. In the barber shop, it has been shown who wins. Who is going to win? A doctor or a community-based medical professional? Please tell me. Community-based. So people need a community-based therapist. So what happened in this study, which was published last month, is in a prestigious journal like New England Journal. So where they have received their therapy at the community level in an innocuous place like a barber shop, had a better control of the BP. If they have to go to the doctor, they need to wait. The treatment control is much less. Whereas the structured therapy in a barber shop achieved a better result. Next please. So what is happening is, the nurses also are going to lead the healthcare management program. We have seen the first example where a clinical pharmacist manages a disease program. A heart failure nurse is a very important part in the Western setting, where control of heart failure is managed by the nurses. Next please. Then the third is information technology. This is the maximum disruptive thing. This is the topic of today. That is the digital healthcare. So information technology specialists are coming from, so you must have seen other day one of the chief ministers of one of the states saying that civil engineers should do civil and they should not do IT. So like that, what we need to understand is, information technology is a spectrum where any of one of you can enter. But what is happening, you are going to a specified sector of information technology where you have got a job opportunity, but create an opportunity towards healthcare IT, which is in its nascent phase. When you are going to put your efforts on healthcare IT, you are definitely going to have a longer life. So doctors are only 7 per 1 lakh. We need 30 doctors per 1 lakh. It is impossible to bridge the gap. So IT will help you to identify which patient is high risk, which patient is low risk, whether a patient has taken a drug, whether the patient has gained weight, whether the patient is moving around like wearable technologies. All of them are possible with IT. So develop an interest in healthcare related IT. Next please. And then these IT professionals can go further beyond into a realm called the big data. We all know when you go to Google, Amazon, based upon your preferences, it suggests you something what you need to buy or something what you want to do. So also this big data, if you have entire thing with us, you will be able to analyze which patient is going to develop diabetes, which patient is going to develop hypertension. In a diabetic patient, which are the parameters based upon which he is going to develop complications. Till date, whatever is being in medicine is based upon the physician's experience. It was never translated into data. Once it is translated into data, that is when your Uber, Swiggy's, Book My Shows will come into medicine. The next phase of Amazon in medicine is going to happen when the big data analytics are transformed into medical care. So now in this group, we can look at people who are going to think of and develop the next Amazon of healthcare. Next, please. So till date, hospital healthcare is hospital based. It has to move beyond the hospital environment. For this, a physician or a nurse will never be able to deliver the care. We need to have multidisciplinary approach, and a disease management program is one of the many steps. So this disease management program can have an opportunity for a clinical pharmacist, a dietitian, a senior nurse or a senior physician. I would try to tell you, I don't know whether there are some clinical pharmacists in the group. Clinical pharmacists being employed in Aarogyasri program is the greatest disgrace for the education what you have done after 6 years of training. So please do not look at only a government employment or an employment with a fixed money. You should always look at opportunities where you create a niche for yourself. That is only possible when you think, read, explore and experiment. So limited data. So till now the data from hospitals is very less. We only have the number of patients who are admitted under a specific specialty. We do not know how many heart failure patients are getting admitted, what is happening to them, what happens to them after going home. All that can be done only when the IT specialists get into the realm of healthcare, and many of you, the business managers or the business management graduates and masters, need to move into quality and healthcare management. Next, please. So we are going to have another opportunity in the healthcare, that is what we call as the Chief Information Officer. In the past we never had this job. Last 2 years we are seeing a Chief Information Officer, where this person is responsible for the IT infrastructure, big data analytics, and for also for prediction, which patient is going to develop problems or which patient responds best to a particular medicine. As we all know, in this group of people, all of us are not the same. Not even two of us are the same. So each person we are giving the same medicine. Every one of you same medicine. But a time will come when we can say, this person will respond better to this medicine, this person will respond better to another medicine, that is based upon your genome mapping. So all those things are not going to take decades. They are going to happen in years. So ladies and gentlemen, next slide please. I would earnestly request you all to look at healthcare as an excellent career opportunity, because this is where you will have a longer shelf life, a fulfilling life, and also a remunerative one. And at the end of this thing, I had met a very huge businessman in a country where he has got a BMW showroom and a Mercedes-Benz showroom in the same city. He met me and says, sir, I am envious of you. I was thinking in my core of my heart, this person has got a BMW showroom, Mercedes showroom, and he has got a liquor empire, like he makes a lot of this beer and all those things. I was thinking this fellow is so much having lot of money. He told me, Dr. Raghu, when this is the only business where you get some money and you are doing good to the people. So healthcare gives you an excellent opportunity for you to do good to the society, at the same time do have a living for yourself. Please do think of this. Don't just think that IT is only the source of life for you. Thank you, ladies and gentlemen, for your patient hearing. Thank you.
Thank you very much, Dr. Raghu. And I sincerely request you all for a great clap. Let me tell you, Dr. Raghu has set up a benchmark. He has set up a benchmark. I've been part of, at least in a year, I do attend 2 international conferences. I was listening inside. I couldn't control my emotions. I couldn't control myself. Amazing talk, sir. You have set up a benchmark. It doesn't look like this community or this forum. We are talking about such a futuristic thing. coming out from a physician saying that it's all about pay for performance. What it means is that the physician is going to get paid only once he is able to deliver the result. In a better way of looking at it is that if he is able to make sure the patients are healthy, they are not getting sick, the physicians and the physician group are going to get paid. Wherein the current system is pay for service. We are paying as a pay for service. Amazing talk. I don't have anything else to add on to this. But when I thought about this particular conference, it has been the biggest challenge for me is that whatever we are saying, it's getting live telecasted. And I'm sure that the entire India, and with this particular talk, the entire world will be looking at us. Let me tell you, the fabulous way of putting it, the care management program, from the person who's there in that exhibit hall till Dr. Raghu, everyone is employed. Look at the statistics, what he told. I was just making a note of it. A fabulous stat. It says a population of 1,000. What it means by population is, I get to see that it's in a population of 500 people. We all to be healthy. 2 care managers. The care managers are those senior nurses and the primary physician who might have upgraded. A primary physician, 4 nurses, care assistants, telecallers, social workers, dietitian, data managers, physiotherapist, health coach, pharmacist, lab assistant. Look at it. 1,000 people, we are able to employ 22 people and say how on the earth we guys are saying we are going to be unemployed. An amazing talk. And another fabulous thing being put over is that healthcare IT complements your core skill. It helps you to perform better. Okay? And as clearly told by Dr. Raghu, I've been in this industry for 15 years. Boys and girls, the young Indians, the future of healthcare, please look at your progressive growth. The shelf life, what he meant by the shelf life is that, I'll tell you a scenario. A 30-year-old person, when he gets married, he has a baby, a college, a school charges you minimum 55,000 rupees school fee. And the average salary, what he meant by the shelf life is close to 25 to 30,000 rupees per month. How are you going to take care of your baby if you're in the other end of the city? Okay? So, again, thank you very much indeed, Dr. Raghu, for setting this benchmark. I bet you that other speakers are going to raise this standard up. Okay? So, are you feeling excited? How many of you felt this is a new topic and you all feel you are a part of this particular ecosystem with a full pride with whatever the studies and education you have done? A fabulous way of putting it, we don't get to see a primary physician. Okay? So, primary physician. So, with this, I would request Ma'am Usha to please come on stage. Okay? And sir, I would be very happy, please accept this as a token of appreciation and a huge respect, okay, from a physician point of view, okay. So Usha, you have to say something about...
An awesome talk and a very relevant one, and I'm sure you all will be a part of it in the coming year. In the coming years, as Dr. Raghu said, it's not going to take decades for this system to come in, but just a few years. We have to just wait and watch and be active in getting this system, that is care management system, to our healthcare system. Thank you, Dr. Raghu.
There's going to be a flood of questions from audience. So questions, please. Mike.
Sir, thank you for your wonderful presentation.
Okay, go ahead.
This is Chandrika from University of Hyderabad, sir.
Yeah.
And my question is, in a developing country like India, where we follow traditional system of medicine, like where we go to doctors and get treated. But when we adapt this type of care management system, what is the acceptability or affordability of the people where we have more of the rural population with socio-economic status? So what is the predictable outcome at least in the future 10 years? Thank you, sir.
Yeah. How we can, is it practicable? What I am telling is it practical? I will tell you from a practicing doctor point of view. I have, for example, I have quite a few patients who come from the rural areas. So when they come to me, previously they never used to ask me, sir, are you going to come to Karimnagar? Are you going to come to Mancherial? Are you going to come to Nizamabad? Sir, please make a visit once in a month. They never used to ask me because the travel was much more easier. Nowadays, for the last 5-6 years, they were asking me. I always used to politely excuse me from those things, from those encounters. But now, what has happened is, I have changed my way of approach to the patient. I tell them, don't worry, you do one thing. If you are having a person in Hyderabad, or you can do it by a WhatsApp. Nowadays, what we are doing is, we are doing a video encounter. I don't do a WhatsApp call because of the time limitation, but what we do is we ask the patient to record these problems in a video form so that I am able to diagnose the problem and communicate back to the patient. Unfortunately, right now what we are doing is unstructured and non-remunerative. But the scene is not far away. People do not want to travel. Previously used to take pride in going to a restaurant and eating. Nowadays they don't want to travel. You want to have the food at home. You want the movie on the Netflix, not standing in a theatre. Healthcare is also going to transform. Did you think that Netflix would be a revolution 5 years ago? Not at all. So this is the only, if you ask me, this is the only sector which has not digitized. So the next opportunity people will invest here only. So it is going to happen. Once it happens, with the proliferation of small phones and thanks to Jio, everyone has got internet now.
Thank you, sir.
Can talk. I have two questions. The first is that you mentioned opening up the fighting a menace of overprescription of would opening to a semi-qualified professionals increase the same menace? The second question is, we often say that there is a shortage of doctors in the country, but when we look at places like Padmarao Nagar, we see a lot of medical students spending 1 year to 5 years to get a postgraduate seat.
Yes.
And in India, the number of postgraduate seats is far less. If you see countries like US, for every undergraduate seat, there is more than one. For example, there are 10,000 undergraduates, there are at least 15 to 18,000 residency seats. Why don't you bring up the professionals from other countries at higher wages than bringing up avenues for semi-qualified professionals or giving a bridge course to Ayush professionals to enter into medical care?
Yeah, very important, two important points you have raised. I will tell you from first question is whether this will lead to drug abuse. I think when we are bringing such measures, we need to have, these are management programs where the protocols are predefined. If the person is not being managed, what is the problem in India? The problem is unstructured healthcare. You can get ceftriaxone also over the counter in India, which is not possible anywhere in the world. Anywhere in the world. You can get alprazolam also over the counter in India if you establish a good rapport with your chemist. So such a sort of lack of regulation has led to a system of medicine which is very bad nowadays. It is an opportunity to bring the system into a structure. When you bring more people into the system and set a rule, then that is where I feel that you are going to deliver better care. The second question is also interlinked with your first question. Why should I will tell you, the other time I had one of our many of our doctors who are working with me, who have got trained in other countries, like in China, Russia and all those things. To my amazement, there are about 15,000 people who are appearing for a entrance examination or the clearance for the whatever is called, for you to enter into the medical line. It is not the right way. You keep thinking in the same line of treating a patient in your clinic. I think this system is not going to get better. We have so many of our friends who are doctors. How many of them have gone to a tier 3 city and practice? How many of them continue to practice there? I know so many doctors who practice from 28 or 30 years of age till 45 to relocate back to Hyderabad. So this is not a sustainable model. A sustainable model is one where you need to think different from the traditional way. You don't, nowadays you are having a lot of changes in the other systems. As long as we are going into the same entrance model, out of these 15,000, 5,000 can easily get employed here, but you are not looking at that. You are only thinking that clearing the exam, doing a MS general surgery, doing a MCH in plastic surgery is the goal of the life. At the end of completing the MCH or DM, that is where the real trouble for you starts. The real trouble starts for you there. I will close this question with one thing. I am a doctor, entrepreneur, and I take a lot of interviews for employing people. I have to tell you, for all of you here, 2 days ago I had an interview from about 15 BBA students, Bachelor of Business Administration students from a college in Hyderabad. I have a girl who is still in front of me. Her father runs a small kirana shop in Chintan. I asked her, what do you dream? She said, sir, I want to work for 2 years and start a startup. I can tell you with courage, I have met thousands of doctors. I haven't met a doctor who said that I want to start a startup. This is the character difference between a doctor and a non-doctor. So we need to, doctor is not a closed arena. We need to bring all people, democratize our medical healthcare workforce. Definitely it is going to add more versatility as well as diversity to our healthcare sector. The healthcare is not just doctors and nurses. Right now you are seeing this change happening. It will change and happen fast from here. Thank you.
Sir, after you all this, I have a small thing which I was actually getting a doubt. For care management team, why can't we include the students who have just graduated? As we all know, we don't have a proper structure, and even the guys who have completed the MBBS, they want to go for a post-graduation course or let it be any other course. So why not we include those people who are in the practical sessions or in the final years, let it be nursing, let it be medicine, let it be dentistry or any other allied professionals. What I think is we can include their practical sessions into the rural areas, and if we can't implement this, then why not we educate the people in the villages itself, as they are not having proper accessibility and availability of services. We can educate people over there for short-term courses and for primary health, as well as we can improve their employment levels. So this way we are improving the accessibility, and on the second part we are even providing the education. And on other aspect, if we see, even in the hospital, as we say there is no proper structure. We are seeing all the negative parts, but why can't we go for a conventional idea? Why don't we keep it as a basic operating part or as a basic practice? As we do hand washing, why don't we include everybody as a team? It shouldn't be like a doctor or a nurse performing his or her responsibility. Instead of that, they all coming together as a collaboration and then making a patient feel that yes, he is cared, and including our ethical values. Is it possible?
Yes, it is not far. It is not far. Previously we never used to have any session on hand hygiene, the last point. Nowadays we grade the ward based upon the hand hygiene the people are implementing. The government also makes so many videos and hand hygiene. So what is happening is, definitely the change is happening, but the change is going to be very rapid. 2 points which this young lady has brought out is, one is, why don't we have an internship for our final year graduates or postgraduates? Yes, that is the way the world is moving. For example, I have 2 of my classmates who children are studying in University of California, UCLA, that's what they call it, UCLA School of Medicine. When they enrolled them, before they enrolled themselves into the UCLA School of Medicine as a medical graduate, preference was given to those people who did their internship or did a research project related to medicine. Those are the people who have been given preference. But unfortunately, in India, it is only on memorizing, writing, which is going to change soon. Nowadays, we never had online examination. The examinations are more going to be analytical than memory power. Then the second question is, are we going to empower them? Yes, no doctor or nurse staff in any part of the world is sufficient for you to take care of simple problems like hypertension, diabetes and heart failure. Unfortunately, in countries like India, heart failure goes to the cardiologist. When I see a primary care physician from countries like West Indies, where I have a friend of mine who comes and sits with me in the OPD, oh, you treat heart failure also? Yes, we treat, this is our bread and butter. No, in heart failure is the realm of primary care physician. But I told him, where is the primary care physician? He is an extinct species in our country. There is no reimbursement. Why people want to stop with primary care, want to stop? Because a primary care physician is reimbursed 50 rupees. There is no reward for him to manage hypertension. Whereas a doctor like me, a cardiologist who does an angioplasty, which will be much shorter encounter, will get remunerated 1,000 times more than what a primary care physician ends up. So this is a clear-cut case of misplaced priorities and misplaced or archaic ways of treating people. It has to change, and it will change for sure. There is a big lobby which is fighting against it. I am also part of that lobby, but the people are the determinants of what they want to get. So I am sure they are the people who are going to determine how this is going to transform. Thank you.
Sir, one